evening, myself Dr. Varun Joshi, and today we will be discussing about diagnostic hip arthroscopy. X-ray PBH showing erosion of bilateral hip joint. MRI hip joint shows erosion of femoral head as well as margins of the acetabulum. Also showing degenerative sclerotic cyst at the hip joints. Also it shows moderate effusion in hip joint. This is the report of MRI. Patient kept on traction table with markings done. First mark the GT, then anterior superior iliac spine. Then draw a straight line from ASIS. All the neurovascular bundle will be medial to it. Anterolateral and posterolateral portal are 1 finger breadth anterior and posterior to the GT. Modified anterior portal is at apex of isosceles triangle. Under CM guidance, guide wire is passed into the hip joint. Dilator is passed over the guide wire. Complete dilation of the track is done. Arthroscopic trocar is passed over the dilated track into the hip joint. Camera inserted into the trocar and diagnostic arthroscopy is started, showing degenerative femoral head, acetabular labrum and thick synovial folds. Whole joint is examined and lavaged and checked for any loose bodies or loose pieces of labrum. As we are viewing from the anterior portal, we can see anterior structures of the hip joint. As this is the case of degeneration in a 20-year-old male, so we have to see the cause of very early degeneration in a male child. So we are suspecting infection or tuberculosis or any kind of metabolic disorder in this child. But looking at the synovium, we suspect that this might be an infection, as degeneration is present in both hips. You can see thick synovial fold along with acetabular labrum. Moving our scope superiorly, we can see femoral head curvature to see any pincer or cam lesion. This is the anterior capsule which we are seeing, and now we are back into the hip joint. Below is the acid. Now to take the biopsy, we have to take modified anterior portal. We check our instrumentation via C-arm. Taking our grasper from modified anterior portal, we take biopsy from synovial tissue as well as from the capsule. Then we introduce our shaver and we clean and debride the hanging synovium or the thick tissue. We make sure our whole hip joint is clear and all synovial tissue and thick capsule is properly debrided so that there is no impingement. This is minimally invasive procedure, so only 2 sutures are done. This is the biopsy material from the capsule and the synovium. Thank you so much.